Awesome. Well, hello, good afternoon, everyone. Welcome to this Operations Peer Network call. We're going to be talking. I've been joking for a good chunk of the year that for the Operations Peer Network, this is the year of HR. We're diving into some HR topics, and today we're going to be hearing from one of our own about employee leave laws and policies. And so I'm going to turn it over to Elizabeth Gibson, and she's our co-chair, one of our co-chairs for the Operations Peer Network. So, Elizabeth, it's your show.
Thanks, Ben. I appreciate it. For those that don't know, I'm the HR director for the Coastal Conservation League. I've been doing, this is scary to say, but 20 years this year of human resources for a variety of industries and nonprofits. So I'm excited to be able to share my knowledge. And all the information that I know. Though I always recommend that if you have some really sticky situations, that when it comes to FMLA and leave laws, that you reach out to your employment lawyer. Um, but I'll just kind of give you a general overview of kind of what's going on in the world today with employee leave laws and policies. So, one of the things that I found very interesting when I was creating the PowerPoint for today to kind of talk through what was going on is that, oops, it went backwards. That there was an article published actually just 2 days ago, talking about that leave requests are back on the rise. Talked about how that more than half of employers reported an increase in employees requesting leave in 2024. Of those that reported an increase, more than half of them experienced like a really, really significant increase. Um, the the primary reasons for leave that we're seeing today are recovering from an injury and illness and then managing mental health challenges. That managing mental health challenges is really, really increasing. The other piece that's increasing is the caring for an aging parent, and then taking parental leave. So those are the four kind of main pillars that we're seeing a lot when leave requests are being asked for. I think it really highlights the growing responsibilities of the sandwich generation that we have going on within our workforce as employees are having to balance both caregiving for children and aging parents. And so it really continues to emphasize the need to enhance benefits to best support our workforce and what can we do to help them be successful in the workplace. So just found that very interesting that it gave all of the data and the numbers about, we started to see a decrease, like a huge, obviously, increase in 2022 post-COVID. Everybody was starting to recover, coming back out, lots of challenges. And there was a little bit of a decrease, but it's starting to go back up again, or it's expected to this year. And then the four main areas. I found that interesting, and I wanted to share that. That there was literally an article posted on Monday about it. Today, I'm going to talk about kind of the leave laws that exist. So FMLA, what we call in HR, the ADA, ADA, but the ADA law, PDA, some other laws. And then when none of those laws apply to us, what are some general and personal leave absence policies? I made a really cool comparison chart, and then we'll talk a little bit about what's right for you. So for those that are just unfamiliar, I'm just going to go over the generic. So FMLA basics. If the biggest thing is that this applies to you if you have 50 or more employees within a 75-mile radius. So this would be applicable to your organization. And then employees are eligible if they've worked for your company for at least 12 months, not necessarily consecutive hours, but they've worked at least 1,250 hours total in the past rolling calendar year. Um, It provides up to 12 weeks of unpaid job protected leave. It covers the employee's serious health condition, caring for an immediate family member, which is designated as a spouse, child, or parent. Um, Bonding with your newborn, adopted, or foster child, and then certain circumstances related to military leave. USERA usually kicks in with the military leave, and then there's up to 26 weeks for the wounded military service member. Some job protection and benefits. Employee must be reinstated to the same or equivalent job after leave. Employer provided health insurance must be maintained by you under the same conditions as if they were working. Under FMLA, there's two types of leave. There is the full FMLA leave, where it's the 12 consecutive weeks, or there's intermittent leave, which can be taken in small amounts instead of one continuous period. Um, though the employee must make reasonable efforts to schedule leave so it doesn't unduly disrupt operations. Additionally, there's some requirements that employees need to provide 30 days notice if the leave is foreseeable. If not, then obviously as soon as possible. But employers can require a medical certification. They can request recertification every 30 days. If you have intermittent FMLA, the rule of thumb, it's not written anywhere, but HR rule of thumb is that you request recertification every 6 months, just to make sure that it's ongoing. This one, you need to make sure that the other piece is that there can be no retaliation. So you need to make sure that your managers are not firing, demoting, disciplining, or discriminating against someone who is taking FMLA or who is on intermittent leave. And we need to make sure that they're not being pressured to work from home while on leave. And we need to make sure that they coordinate with other things that might be going on at the same time. The one thing about FMLA is it can run concurrently with other leave policies if applicable. Sometimes there's not in our state, but sometimes there's state laws, short-term disability, other things like that. Just kind of wanted to give you guys a high-level overview of that one. Um, in my experience, these are some FMLA mistakes that we need to avoid. You need to make sure that if you have over 50 employees, and I do mean 50, 51, 52, that you have a formal FMLA policy in place. This is critical for your organization. One of the things that I have seen in the past is that sometimes when someone is on workers' comp, that it is misclassified, counting that light duty is FMLA leave. That is not the same thing. Workers' comp is different. Untrained managers. So making sure that you give the tools to your managers to know that they need to be reporting to, if you have an HR department or operations or whoever manages your leave policy, that if they know something is going on or if they think something is going on, that they are aware of it and they're sharing with you so that you can issue any or address it. And that documentation issues, making sure that your appropriate notices are sent out. I see a comment. Is that Kendall, what do you mean? Is that full-time employees or any category of employees? Are you talking about the
Yeah, the
1,250 hours?
the 50 employees.
Yep, any 50
Okay,
employees. That's it. Yep.
great. Thank you.
That was a great question. Thank you. All right. ADA overview. So ADA can have crossover with FMLA, which can be a challenge in and of itself. The thing to know about ADA is that this starts day one. So an employee is eligible to have ADA accommodations day one. It does apply to any organization that is 15 or more employees. It's a federal requirement. And then time frame. There is no set time frame of the accommodation for an organization unless it creates undue hardship. I will tell you that justifying an undue hardship is hard. But there are ways to do it, and that if you are in that circumstance, I highly recommend working with an employee relations lawyer. Yes, even with all of my years of experience, I have had to work through an undue hardship of someone who was taking an excessive amount of leave based on an ADA issue. So it's not unheard of. And then obviously coverage is really about accommodations for disabilities. So a couple of things to know, kind of in more in depth. Um, of the crossover between FMLA and ADA. So while FMLA provides leave, ADA provides workplace accommodations. FMLA grants job protected leave, like we said, up to 12 weeks for serious health conditions, and ADA requires reasonable accommodations to help employees perform their job despite their disability. However, an example would be of where these crossover. Let's say an employee with severe debilitating migraines may qualify for FMLA leave for severe episodes, but also need ADA accommodations such as a modified work schedule. So they could qualify for that intermittent FMLA leave, but then from an ADA perspective, we need as an organization to maybe their schedule needs to be shifted from instead of a 9 to 5, a 10 to 6, or they do better in the morning, so it needs to be an 8 to 4 instead of a 9 to 5. That would be considered a reasonable accommodation. The other ADA accommodations that I've run into with a crossover from FMLA, and this is very much a personal experience, where we've had someone who went on FMLA and they had knee surgery, but the knee surgery didn't go very well. And so the accommodation was we need 2 more weeks off, unpaid, before we would be able to come back to work. Well, I can't hire and train and put somebody back into a position in 2 weeks. So that would be a reasonable condition under ADA to extend leave for 2 weeks. And then the situation turned into, well, I can work a modified schedule, but I can work it for 4 weeks while I'm still going to physical therapy. That would still qualify under ADA to be a reasonable extension of FMLA and intermittent leave, because once again, I can't hire and train someone to backfill and be able to do all of that person's position in that short time frame, and it would not classify as an undue hardship. Oh, Ben put a great or modified working environment like lower light. Yes, those are all great things for um, uh, modified work areas. So this is the big piece that I think that people need to be aware of, is that there's that crossover between the ADA and the FMLA, and sometimes extending that FMLA by a couple of extra weeks, or intermittent FMLA, extending intermittent FMLA can be considered a reasonable accommodation under ADA. Yes, Ben.
So just a comment on accommodations, because I think many times if folks don't necessarily have a firm grasp on ADA and they feel like they hear the word accommodation and they see dollar signs and negative dollar signs at that. Um, and I just kind of want to stress that you can get really clever with accommodations and really very affordable with them. I mean, I think the threshold for what might be unreasonable is much higher than you might think it is. And so even, if somebody just says, "Hey, I need lower lighting and I need a little bit of quiet in my office environment," like that's not hard to do necessarily.
Yep.
And a lot of other things can be worked out, and it doesn't need to become a source of conflict with the employee, right? Um,
I
and
would
and if you have, I would recommend, if you're curious about workplace accommodations and how to kind of make that work, Able SC is an excellent resource for helping folks with that.
That's great. Yeah, some of the accommodations that I've worked with in the past have been um, standing desk, because somebody had back problems, couldn't lift, couldn't sit. Sometimes I've had to buy a new office chair because again, back problems. knee problems, like those physical challenges, the migraines, exactly what you were talking about, the ability to lower lighting. Um, Sometimes with migraines, I've had to do, let somebody work from home because they can work in low lighting, but it has to be really quiet, so that it doesn't trigger them. That's a reasonable for some positions, I'll say it like this. That could be a reasonable accommodation. I've also worked in the medical field, and sometimes what we've needed is like an adaptive piece to equipment that for hearing issues. I've worked through those. Um, from a hearing perspective, we've made sure that we have Zoom has closed captioning. I know Together SC just did all of the closed captioning at their big summit. So we also did have to change out in the past our conferencing system to make sure that the speaker was more clear than what we had. That's not an unreasonable accommodation to change out your speaker video capability system. It's just a couple $100, all reasonable things. So, those are just some examples that I've personally experienced.
Elizabeth, can you explain to us how you go about like the ADA piece? Like I understand if somebody is, um, I mean, we have people who have migraines, but who like I guess I'm not asking it right, but like with FMLA, somebody says, "Hey, I need to apply from FMLA," or you say, "Hey, you're having this issue. Have you thought about FMLA?" And you share the information. How does the ADA like piece start for something that we're not talking about like as somebody who's paraplegic or somebody who has a
Yeah.
hearing issue or whatever else. Yeah.
So, usually you start obviously there's two ways to start it. Sometimes it's they're going to take the initiative and go, I need help. And here's what's going on, and this is my situation. And then you go, oh, okay, maybe we can do an accommodation for you of what's going on. Um, the other one is I've worked with people that have some type of disability that, of course, don't want to share it. And so, unfortunately, how it can show up is in job performance. And so, sometimes you're going to have the conversation where, you're not meeting expectations. Is there something going on that I need to be aware of so that I can help you? And then that will start your interactive ADA conversation.
So if you have somebody who doesn't like ever come forward,
Mm-hmm.
or I mean, what is the threshold of being expected to make accommodations if it's not clear?
Have you, the threshold is, have you had a conversation to say, is there something going on that I can help you with, that I should be aware of to provide tools to you?
Gotcha. Thank you.
Yep. See, I'm sorry, I was looking at all of the answers. You guys are having a great conversation without me, so I'll keep going. Um, let's see, we talked about leave. Okay, so ADA does not require a specific length of service. I think we talked about that. So I'm reading through all of my bullet points to make sure that I cover everything. The FMLA, like I talked about, requires 12 months of work and 1,250 hours, but ADA, it's immediately upon hire. Now, you under ADA and FMLA, you can require you can request medical certification. Um, but under the ADA, it needs to be it needs to be included in the interactive process of what I was talking about, the interactive conversation, to determine reasonable accommodations, to make sure that we are meeting the needs appropriately. Um, just kind of some intermittent FMLA, which I talked about, can apply to both ADA and FMLA. So we talked about FMLA as intermittent leave, but under ADA, we could have a flexible schedule or we could have additional breaks to acquire the accommodation. The example that I've worked with in the past where it covers that, again, with that FMLA and the ADA crossover, could be a cancer patient who needs to take FMLA leave for chemotherapy, but needs ADA accommodations throughout the day, which could be rest breaks, modified schedule, work remotely a couple days after they've maybe received treatment. So that's kind of what I have for ADA. The one thing is the undue hardship standard for employees. So under ADA, employees are not required to provide accommodations that cause significant difficulty or expense, an undue hardship. However, as I said before, this is a really high bar, especially if you're one of the larger employers. Larger employers usually have to provide a lot more accommodations than smaller ones because, again, that really high bar, proving that it's a huge difficulty or impairment on business operations. I will tell you I have worked for large employers in the past as well. To give you an example, we did have an FMLA scenario where somebody, blew through the 12 weeks of leave, and then the initial request was 4 weeks, and then I can come back to work, and then they kept trying to extend it and extend it and extend it. Well, then we were starting to significantly impair operations, and I worked with our employment lawyer, and so we weren't able to protect that employee's job anymore just because the undue hardship of continuing to hold that position was no longer considered reasonable. Just kind of quick recap, just remember that employee can, if you're over 50, can qualify for both FMLA and ADA, and you do, as an employer, have to evaluate the requests separately. The other one that I want to highlight is our Pregnancy Discrimination Act. And I keep checking. Pregnancy Discrimination Act. There we go. So just as a reminder, Pregnancy Discrimination Act, again, day one. The time frame is really about that from moment of pregnancy through childbirth and recovery. Recovery is based on the physician's doctor's note. And it's the coverage is, and again, any pregnancy related conditions, you treat it like a temporary disability. And again, your company size has to be 15 or more employees. Just some other important leave laws to be aware of. So USERA, it's very similar. It usually coincides with FMLA, but covers all employers. It protects military service members' reemployment rights. There is workers' compensation. Please make sure you're working with your employment lawyer. In the state of South Carolina, workers' compensation coverage is required if your company has 4 or more employees. And then some states have additional leave laws beyond federal laws. Ours does not, that I'm aware of, though there is specific South Carolina pregnancy disability awareness things to be aware of. Try to make sure I have everything. Ooh, too many. Sorry, guys. So last but not least, I just wanted to compare for everybody so that you could see leave options. And so there's the FMLA, the ADA, and the PADA. And then we have the personal leave of absence. And so personal leave of absence is really for reasons not covered by FMLA, PDA, or ADA, ADA. I will share with you that the SHRM, Society for Human Resources Management Network, does provide some policies that you can use and then adapt for yourself. And so the one that I found with them, and I'll share it here in just a second, is that typically you're eligible after 90 days. It's duration is company discretion, and really it's up to you for your organization. But you as your organization, you guys have to balance compliance, obviously, with your organizational needs. So you have to figure out how is it going to work for you from an employee impact, from an organizational impact, from company needs? Are you able to meet all of the expectations of your organization? And sometimes you'll have to be aware of, are there any additional laws? And so if you'll give me 1 second, what I was going to do is share. I pulled the unpaid personal leave. Oh, that's the wrong thing. Um, personal leave of absence form from the SHRM website, just so that we could take a quick look at it. So it allows you to pop in what you would want to. You can put your company name. As you can see, provisions, it talks about 90 days they're eligible for an unpaid personal leave, that they'll attempt to hold the position open. It lays it all out there for you, just as a potential framework for you to be able to use. So I do highly recommend that if you don't have an HR person, or even if you do have an HR person, that Society for Human Resources Management has a lot of policies and framework and procedures and best practices available on the website to utilize that will help you as you are developing this policy for yourselves. The other one that I thought was very interesting that I wanted to share is that it does have additionally a critical personal leave of absence policy that you would be able to use. This one is, as you can see at the top, specifically written about non-FMLA and non-military, but could be obviously any of these reasons. Just felt like it was something to be able to share with you guys when you're thinking about leaves of absence. Um, let's see, I'm trying to go through all of your questions. So yes, so Andrea commented that you don't need a specific leave policy for ADA, just as long as you're considering leave as an accommodation, and that is correct. Meg Temple asked, with pregnancy, does it matter how long they have been employed by FMLA? Nope, starts day one. Oh, Andrea already got me. Any other questions?
Feel free to mute or rather unmute yourself if you want to ask over voice, or if you want to uh, put it in the chat box, we can do that as well.
For small nonprofits, um, should you have a policy anyway, even though you're not legally required to?
I recommend, I mean, now this is just me as Elizabeth, an HR director. I will say this, we qualify for ADA and we qualify for PDA, but we do not qualify for FMLA. So we have a personal leave of absence policy that mirrors an FMLA policy. And we do it that way because it's that crossover of the ADA and the FMLA and my experience of working with the EEOC as well. Just gonna throw that out there, that because we followed a FMLA practice, even though that we weren't required to, for somebody who was on ADA, or there was FML, like time off was the consideration, it went in our favor. So it provides a protection to the organization. I do recommend that you have a personal leave of absence policy.
Thank you, Elizabeth.
You're welcome. What other questions? And if you guys are open to sharing, like I said, we are not quite 50, but our personal leave of absence policy does mirror FMLA just from a protection standpoint. I think ours is a little bit different from the perspective of if you need a personal leave of absence, we ask you to be employed 6 months before you would be requesting an unpaid personal leave of absence. That's probably the one small difference, that if we do hit 50, I can easily change in our handbook and on our policy when we roll up to 50. What other questions do you guys have? Does everybody have a personal leave of absence policy?
Not yet.
But now you're going to write one, Amanda, aren't you?
Not
Yes.
yet. Yeah, I'm about to write one also.
I'm pretty sure we do. We got our personnel handbook updated a couple of years ago. We've been sort of working through
Mhm.
them to try to make sure they're kept up to date. I'm pretty sure that when you have a smaller team,
Mhm.
some of these things just don't come up often enough, and so you don't think about them, and then suddenly when it does come up, you
Yeah.
don't want to be caught, flat-footed about it.
Absolutely. Which is why if you have definitely if you have 15, if you have between that 15 and 50, I highly, highly recommend that your personal leave of absence policy maybe looks like FMLA because it's a really good protection factor. It's already a federal standard that's out there. And what you can do as an employer is show, look, we don't have to follow this policy, this federal, because we're not big enough, but we go above and beyond for our employers to provide a policy that looks like this so that we are thinking in the interest of our workforce.
Mhm.
And by the same token, Elizabeth, I think even if I've worked for very small nonprofits where you do have under 15
Mhm.
or maybe you're getting close. So it is good to have something in writing for ADA or even just personal leave, just so that you're ahead of the game and you're getting ready for it.
Yes, it's absolutely, and so you're prepared in the event that I'm going to say it like this, when it happens, because you can think it's never going to, and when it happens, because I've like, oh no, nothing's, it's going to happen. You don't want it
Yeah.
to, but as Ben said, you don't want to be caught flat-footed. So if you can have that policy in place, even a basic one, even if it's 6 weeks, if it's after 90 days of employment, whatever you can do. The other side to this too is that it's a really good selling point for your employees to say, we want you to know that we really care about you, and if something happens, that we have this policy in place to here to support you in whatever may be happening to you outside of work. Any other questions or thoughts, ideas for discussion?
I'm just putting in the chat here. If you have other questions that come up, if after we hang up this call you say to yourself, "Oh, dang it, I wish I had asked that," don't forget that we have the Operations Peer Network discussion group online at groups.togethersc.org. And you can, if you're not a part of that group, you can join in the conversation there. It works a lot like a online message board, but it also works kind of like an old school listserv. You can post your questions, your colleagues and other organizations can see them and answer. And it's a great way for us to share resources and information with each other. And then I also just want to let everybody know our next Operations Peer Network call is going to be on April 30th. And that's going to be, we're going to dive out of HR for just a minute. And we're going to have just a candid conversation about audits. So, if you're saying to yourself, gosh, audits are getting a little expensive, we're going to have a candid conversation about audits and, how to prepare for those.
Yes, we're going to let Amanda lead that one.
I
The
was gonna
finance
say we
operation.
need an auditor.
I have a quick question, right? So I'm going to add in the personal leave of absence policy to our handbook. After I make edits like that, do I need to have it reviewed by a lawyer, or is that a best practice? Yes.
That's the
Okay.
best practice. Yep.
Okay, great. Thank you.
It's a great question, Kendall. If you're also members of the SHRM, so like I said, Society for Human Resources Management, so shrm.org, they have And I know that Amanda is also a member of SHRM as well, but they have lots of samples, they have policies, they have the forms. It's all created for you. Any other questions that I can answer or thoughts for discussion?
So we had this past year, two new employees come on, two clinicians. One we knew was pregnant when she came on, and then one got pregnant very shortly after. And so they were not employed for FMLA during the but we just treated it like FMLA. I mean, we again knew one was pregnant when we were hiring, and so we just, tried to have the same old discussions. But then we were a little bit concerned, I guess, towards the end of one of so one of them ended up being a much more difficult pregnancy, and so she was going to hit her year during the middle of the time that we were, that she was out. And so she'd gone out early. And so she took, and it ended up working out. But one of our concerns was because we had treated it as FMLA and then she was eligible for FMLA, could it have been a situation where she came in and said, hey, I want 12 weeks at the year, and will we legally had to provide that? Does that make sense?
It does. I think you would have been in a sticky situation. Yes, the potential existed.
Okay. And we were trying to do the right thing,
Yes.
but then we were worried about if we were going to be the ones.
Yeah, because the other piece to think about that is not just the FMLA, but you have the pregnancy disability accommodation now as well. And it says for the term of the pregnancy and recovery.
Mhm.
So her physician could have said that her recovery was going to take 14 weeks because, speaking as a parent and having been through that, I had, this is totally personal. I had one that was really great, and I had one where I was very ill and in and out of the hospital. And so I had a very long
Mhm.
pregnancy accommodation. But it's a great question. But again, that's where that leave, all of those policies, they all can cross over and intersect and end up extending necessarily what you're required to give, because then the next one kicks in, right? So you could have the 12 weeks of FMLA, but then you have the pregnancy disability accommodation where you get the physician rights that they need an additional 4 weeks, and then that's still under the umbrella of accommodation that is considered reasonable.
Right. I think one of the biggest things for us is, and as y'all talk about in that and the accommodations, is the differences of positions. So, that's a clinician. She was, you see clients, there are clients who are not being seen, who are having to be it's a bigger, much harder place to fill than say, somebody who's sitting at the front desk and, taking intake calls and whatever else. And so then trying to also have I don't know, it's always balanced. It's so hard in nonprofit, I think, and especially we're not too tiny, but we're not big. Balancing the business part of it, balancing the client part of it, and balancing the employee part of it, and trying to do the best for everybody.
Yes, it can be a balancing act. And it can definitely be challenging. The one thing that I just want to plug in there again is that ceiling for undue hardship can be pretty high. And I highly recommend that if you think that you're running into that line of undue hardship, that you are working with an employment lawyer. That's a great example there, Meg, because I've run into that in big organizations too.
Yeah.
Any other thoughts, stories, questions that I can answer for you guys?
I'll ask a question that I was looking on our peer network discussion board, and this is from a while back, but I think it's not necessarily about the policy, but it's about the benefit. So FMLA guarantees 12 weeks of unpaid leave. Does anyone pay for any of the employees' time during that time, apart from like maybe a short-term disability? Be interested. No.
I think every organization is a little bit different. I'll say that the Coastal Conservation League, we have a healthy time off plan that they can utilize if they so choose. And then we do have parental leave. I think the state just up there is, I think the state is at 6 weeks. I could totally be wrong about that. So somebody can correct
The
me.
state does have, I mean, some level of paid
Yeah,
paid
the
parental leave
state
at
does
this
have a
point.
full, yeah. I think it's 6 weeks.
We would like to, I mean, that's one of our goals to have
Mhm.
some level of paid parental leave.
Mhm.
We haven't gotten there.
Our paid
Again,
parental
it's part
leave,
of that balancing. It's that
Yes,
balancing
yeah.
part.
our paid parental leave, is that you have to have 1 year of employment, and we pay 100% of salary for the first 4 weeks of leave,
That's good.
and then can request up to 8 of additional unpaid. We also have an executive director who is pregnant with her 5th.
Oh,
So,
wow. But I think,
yeah.
Kendall, that's a good way to start. Like, I mean, you know, if you can do, I mean, maybe instead of me putting it off, maybe I need to be able to work towards, can I do 2 weeks? And then can I like,
Right,
Mhm.
right.
you do just a
Yeah.
slow amount and then.
Yep.
I absolutely agree with that, Meg. I will share that Coastal Conservation League, we started off at 4 weeks. And then we were able to eventually grow it to 8 weeks for paid parental leave. And then we actually just this year we had a cap on how much you could accrue for your sick time, and then we have increased that cap to allow for sick time to be used for any situation that you might need a personal leave of absence for, to not only care for yourself. I mean, because we have short-term disability, but what if you're caring for we just talked about caring for that aging parent where you need time off. Well, now our bank is a little bit higher to be able to provide some level of coverage and pay for our employees if they're having to go do, I would say, non-personal medical caregiver, whatever
Right.
issues.
And then I wanted to also mention, in terms of our leave policy or parental leave, we kind of do it on a case by case basis. So, for example, we hired somebody who's had less than 6 months of employment, and their wife had a baby, and so that was a case by case basis, and so they received 2 weeks of paid leave for that.
I would say I still find that incredibly reasonable and kind, and very inclusive, employer of choice kind of behavior. That's saying like, look, we really do. We care about you. We want you to, enjoy time with your family, because in those first 2 weeks, person probably wouldn't have been the most 100% present and being able to be with their jobs. And so if you're able to give some of that time off, that then lets them take that mental space to provide the care that they want and or need to, then they're able to come back and give the dedication to your organization that you're hoping to get. Any other questions? Thoughts, ideas?
What other, I'd be interested as well, just in what other policies or things like people have. We've got like, like 3 days for bereavement. We've got like 20 hours for volunteer, like that staff can use for volunteer time. Um, and I think just some good leave time, that kind of thing. But I'd be interested at another one of my goals is try and work up to being able to have longer term employees have access to a sabbatical. And I know that's something that was talked about a couple of years ago with Together SD's summit. So
Yeah, I think we did a recording on the sabbatical policy. I think that was fall of 2023. If memory serves right, that recording should still be around somewhere on our YouTube channel.
It was a nice plug there, Ben.
Like and subscribe.
Like and subscribe. I will share with you, Meg, that we just actually did a survey. I mean, did a whole refresh and evaluation of our benefits, and heavily looked at leave time, and it is becoming more common among organizations that are looking to be able to call themselves employer of choice, to win over, would be volunteer time, bereavement time, pet bereavement time, because a lot of people who don't have children, but have lots of fur babies and things happen. Our organization actually has 1 day of pet bereavement time. And so I was starting to see those be pretty common. Um, I mean, it wasn't a huge amount of time, but it was sharing with our potential employees. I mean, it's nice for me as an employer to share with potential employees as I'm working on recruiting them to say, hey, we have and we want you to use volunteer time to go back and help the community, because here we are as a nonprofit trying to help our communities, but we want you to go, like, is there other avenues that we can do that through as well?
I recently added to our handbook a jury duty policy. That was something that we had never had before. So I saw one example where an organization paid up to 20 days of jury duty. We're starting with 5. um, um, So yeah, we added in that, and then a military leave policy. I mean, basically, we just said it kind of like a case by case basis. Contact your immediate supervisor. Um, we are in accordance with the Uniform Services and Employment and Reemployment Rights Act.
Lovingly known as USERA.
Yes, correct.
Has anybody else added anything unique or different? Yes, Ben, I think what is it, $25 is what it's up to now for jury duty.
Well, in Columbia, it was 12.
Okay. Okay, Dorchester County down near Charleston is up to 25.
That's where you want to move if you want to get some real jury duty
Yeah.
done.
It was still a hike for me. Because I live down like where Dorchester touches Charleston, and our county seat is way way west.